Ma'am, but back then, why did they do the 3-day transfer, ma'am? But no, why not the 5-day transfer?
The research has been said that day 3 transfer also give pregnancies. It's not like that day 3 transfer does not give pregnancies. But we have an actual picture on day 5 because that is about to implant.
So, ma'am, like you picked up 20 eggs, but they came up to 10 embryos. They formed into 10 embryos. Okay. So, how many are you going to implant, ma'am?
If you are telling 10 embryos are there, day 5. So, implantation rate we grade in A, B, C, D category. If A, B, C categories, it's good for transfers, embryo freezings. D category is not good for transfers and freezings. A category means there is the criteria of ISA guidelines, means ART guidelines only we use. Our SOP is there. In a Salma trophectorum, we see every embryos and we'll grade and we will tell that it will implant or means normally if a good grade embryos also we transfer, sometimes we don't get pregnancies also because that embryo has the capacity of implantation to the body also, because this is in the lab we have done. Actually the potential has to implant in the uterus also.
You are doing 2 embryo transfer basically to all the patients, but why not one embryo transfer?
Single embryo transfer is also done, so implantation rate is also there because recently only last month we have done single embryo transfer and we got the pregnancies. But if 2 embryos transfers, why means if one is not implanted, the other can implantation rate is there, so patients will have a benefit of that.
So, ma'am, basically, what is genetic testing, ma'am? You usually do it on the 5th day of the embryo transfer.
Yes, genetic testing is if the embryos has a genetic abnormality, if the patient has a history of the abnormality, genetic factors are there. With this PGT-SR, PGT-A, everything we can analyze that before transferring. After means if the embryos is transferred without having a genetic history of that patient, means if the couple has the history of some genetic factors, due to this we can stop after implantation. If the it positive also, it will finally they have to not face that problem, so prior in the ground level only we can test this.
So, ma'am, while doing these embryo transfer and everything, like while doing ICSI or some sterilization, denuding processes, can you make any alterations in the genetic level? Like if they have any systemic problems, they're continuing by passing through generations, can you eradicate them while doing this process?
No, actual picture we know on day 5 only. When the embryos is formed, that time only we can send the embryos. We are taking a chunk of it by the genetic testing. Only we will know that.
So we can't manipulate anything genetically. We are just helping them to get positive. That's
yes,
it.
Yes.
So, ma'am, what is PGTA, ma'am?
Pre-genetic test means prior, means implantation before only genetic testing is done. As I said you, if the patient has an history of genetic abnormalities, means in their family something genetic abnormality is that prior only we are doing the test before transferring the embryo in the uterus.